Excellent, excellent, excellent. I'm going to talk about creating a culture for mental wellness, and I'm going to share my screen. See if I can do it the way I plan to. Just came in the room. I am the MESSA Health Promotion Consultant. I'm a registered nurse. I have additional coursework in cardiovascular disease, nutrition, and fitness. Outside of what I do with MESSA, I teach group exercise classes like Zumba and boot camp. I do some personal training, and I'm very much dedicated to fitness and learning more about nutrition and wellness and all those things associated. And so glad you can make it today to our conference. So what I want to do is talk to you about how you can create a culture that can support mental wellness. Now, as we just heard, when we are dealing with mental wellness, nutrition and movement go along with that. So the three pillars, I like to call it, the three principles that we work with for Worksite Wellness or helping our members build a Worksite Wellness program is mindfulness. So your mindset, which includes attitude, mood, movement, which now we know movement is not just going to the gym. It could be activities of daily living. It could be washing your car, it could be doing your garden, and nutrition. And when we talk about nutrition, we're just talking about targeting food groups that are nutrient dense. And I'll talk about more of that when we get into this. So what I'm gonna tell you today is I'm gonna talk about some of the health survey and assessment sources we have, resources, how you can plan a Worksite Wellness program, how I can help you, and some of our programs. If you have a question, put it in the chat. I can't see the chat right now, but we have people looking out for us, and they'll let me know if there's some questions, okay? As the health promotion consultant, I can come out and sit with you or your team or your committee and help you create an environment that supports wellness. You can call it a wellness team, a wellness committee. It could be a committee of one. You could be the wellness liaison. It doesn't take much. And the way I like to do it is we want your perspective on what's needed. Even though it's kind of cookie cutter, we have a framework for you, but you know what you need at your district, at your work site, at your municipality, at your university. So I help you decide what is best, what is necessary, how customized you want your plan. Some of the resources, and you can find these resources at mesa.org. Once you're on the website, you'll see a category called MESSA Wellness, and you just follow that to these wellness resources. First off, the health risk assessment. This is for our MESSA members who are the employed person, the enrolled person, okay? So this would exclude family members. Our health risk assessment is a way for you personally to identify your health risks, okay? So if you're on here for your own personal wellness, let's say you're not here for a wellness committee, you just want to hear some strategies and tips for yourself and you're wondering, where should I start? Well, the health risk assessment is a great idea, okay? We all need to know what we're at risk for before we can plan our wellness journey. Okay, you got to know where you're going before you take the journey. And that's exactly what the health risk assessment is. You can find it in the My MESSA area of our website. So you have to have credentials, a password, a username. You go in there, you click on health risk assessment, and it'll take you to another website. You do a simple questionnaire. It may take maybe 15 minutes. And the questions are around your health history, medical conditions. Are you a smoker? Do you exercise? How many servings of fruits and vegetables are you eating? When you complete the questionnaire, you'll get immediate feedback. And basically, you'll get information and recommendations on what you need to do to start your wellness journey. Very simple to do. And don't worry, the information is private and confidential. I don't even have access to your answers, okay? No, your benefit office doesn't have access to your answers. No, your employer doesn't have access to the answers. It is HIPAA compliant. So it's completely private and confidential only for you. So you can use that plan to kick off your journey, to motivate you to start doing what you already kind of know what you need to do, but you're in that contemplation stage. You just need something to move you forward into action. The health risk assessment is for you. Now, if you're here because you want to start an initiative at your work site and you're wondering, how should I start? Who should I target? What is the aim? What kind of goals should I create? Well, this can help you as well, because I can generate an aggregate report from your district, okay? So let's say you're representing your district. You want to do something for Huron Valley. You want to do something, and your district is mostly MESSA members. What you would do is you would create a campaign and encourage people to take the health risk assessment for the reasons I just stated. They want to start a wellness journey. And once they're done, I can generate a report for you as a program planner. This report is an aggregate, it's de-identified. There's no names on it, no numbers. It's just aggregate data that says ABC district has this percentage of people that are not eating enough fruits and vegetables, for example. ABC district has this percentage of people that are sedentary, okay? See how that works? You as a program planner, light bulb goes off, okay, we need to start increasing awareness of the risk factors of being sedentary, okay? We need to send more information to people to encourage them to move. We need to create an activity, maybe get some information from Carolyn and see how we can incorporate more movement in the office. Now, if you're in the elementary school, I've been out to your elementary schools. I know that you're chasing kids. So that might not be the issue of being sedentary, but for some workspaces, sitting for a prolonged time can be an issue. So this might be something, or doing a health risk assessment can help you identify what the risks are for a population instead of an individual. Health interest survey. Again, this is at mesa.org if you want to do this. And actually, if you got on your browser, your internet, you could probably put in a health interest survey, worksite wellness interest survey, and get plenty of examples of surveys. This is just to get you started, okay? You can customize it based on your need, but this is directed to everyone at your district, everyone at your municipality office, okay? Everyone at your university department. They don't have to be a MESSA member. You just want to know what their interests are in the realm of health. You can rename it to wellness interest survey if you wanted to, or health and wellness interest survey, or you can name it self-care survey. You can customize it any way you want to customize it. You can add questions based on your environment or based on some issues you and your committee have identified. For example, you might have issues with communication at your work site where you've planned events and people will say, well, I didn't know about it. I didn't hear about it. I didn't read about it in the break room. So with the health interest survey, you want to include a question finding out what is the preferred method of communication. Do you want your communication via break room, during meetings, on the website? You see how you can just add things to make it more customized to your target population. You're basically gathering information to help you plan the activities. So often we sit in meetings and we plan things and then we're disappointed because no one shows up. Well, we'll have a higher participation rate if we ask them what they want to do. Then we're more likely to plan something that people actually want to do when they want to do it, and we'll communicate in a way that they'll hear about it. So that's your health interest survey. And last is our wellness report card. This is for MESSA members only. So if you have a district that has a mix of health plans, you have some units that have MESSA and some that don't, or you have some people that are part-time or are taking their spouse's insurance, this might not give the complete picture, but it can be useful. It's basically a snapshot of your district's health plan utilization. How are they utilizing the benefits, especially those benefits that are free, that can help identify health issues early, your health screenings, your preventive care services, your wellness exam. gives us a snapshot view of the percentage of people that are doing those services that have been recommended for early identification. How can that help you? Well, as the liaison, the wellness liaison, or the wellness committee, you're planning activities. You want people to be more aware of their MESSA benefits. Oftentimes, during enrollment, people don't always ask the questions that they'll need 6 months down the line or a year down the line. This is a great way to expose people to what MESSA has to offer that is of no cost and that is encouraged by government health agencies, the Preventative Care Task Force. They encourage us to get our colonoscopy based on our age and gender, to get a mammogram based on our age and gender. So that information your team can use to decide, okay, most of our people, you might find that a high percentage of your people are not getting their annual physical. Something simple that everyone should get. But we know that the school industry, education industry, municipalities, people that serve other people sometimes don't take care of themselves or take the time for that until there is a sickness or illness involved. We want to encourage people to create a relationship with their healthcare provider and become more aware of their health before sickness arises. So this is a great way to encourage people to get their physical. You at this, for example, on this slide, this report card says MESSA Book of Business, BOB, 49.39% of the people have received their annual physical. Well, it's free. Let's say we want a goal of 75%. So we create an activity to raise the awareness of this benefit and the how beneficial it is to people. The benefits of getting a physical, the benefits of the benefit, right? Again, this is a great way to expose people to their MESSA benefit and to help people start on their wellness journey. Planning resources. Get you started going. We have a Worksite Wellness Toolkit, can get you started. Again, you can download that at MESSA.org. We use the principles of mindfulness, movement, and nutrition, and we'll be talking about that through this conference, mindfulness, movement, and nutrition, and how you can incorporate it into activities, education, even newsletters for your Worksite Wellness Conference. A wellness activity calendar. Now you can use this for yourself. If you, there's something about writing things down. Writing down your goals and seeing them energizes those goals. I was talking to a member the other day and she had some personal goals. I was walking through the room and she stopped me. So I kind of helped her with it, wrote down some goals, and immediately she got a dopamine rush, seeing it on paper, envisioning the goal, write the vision, make it plain, right? And she was more what's the word I want to use? More energized. I guess I said it. More energized to do it. She was ready, prepared, ready to take action. So your wellness committee can benefit from just writing down things you want to do. Pull out your school calendar, pull out this calendar, and start planning activities for the school year. And right now is the best time to start planning for the upcoming school year in September. And actually, next Wednesday is the Wellness Pro Wednesday. Every third Wednesday of the month, I call them Wellness Pros, and we talk about different ideas for wellness activities. Well, next Wednesday, we'll be talking about planning activities for the upcoming school year. So now is the best time to start planning for the upcoming school year. That chat looks loaded. Is there any questions for me? I can't see it. So health and wellness campaign templates also found on our website. So I talked about the wellness report card. There are templates that can help you use that report card and turn those categories into, let me go back, turn these categories: preventive, compliance, chronic conditions. You can turn those into campaigns, and we have the campaigns on our website. So say you want to do a campaign on preventative health care. It's step-by-step instructions at MESSA.org. Also, campaign categories: self-care and mental wellness. And again, our pillars are mindfulness, movement, and nutrition. Let's talk about how we can build a wellness plan. So mindfulness, I'm thinking most people are familiar with that term, mindfulness. Uh, it's, uh, it's a contemporary term for ancient practice, meditation. So it's very common. If you've done yoga, you are familiar with mindfulness. If you used to count sheep as a child, you are familiar with mindfulness. It's a practice of the present, thinking about or not thinking about, or let me say it better, avoiding or practicing moving your thoughts from the distraction to the focus at hand. So often, especially in this industry, okay, especially the people on this platform, including myself, we are just inundated with so many distractions. We built our lifestyle around distractions and multitasking. Well, when we do that, our brain takes on our behavior. Our brain is neuroplastic, right? Our brain takes on our behavior. So it's shaped that way. So it's automatically going to shift in and out of the future, the past, the present, and it's hard to focus into the present. So mindfulness is being intentional about being aware of what's happening now, and it takes practice. And research tells us that practicing mindfulness can help reduce stress. Okay, it can help lower the stress hormone cortisol. It can help us engage better with relationships. It can help reduce depression and anxiety. Okay, and it doesn't happen just automatic. It's just like exercise or just like anything else. It takes being intentional, and it takes practice. You can create activities for your worksite, for your worksite wellness program around mindfulness. Again, benefits of mindfulness: it reduces anxiety and depression, just like movement can reduce anxiety and depression. And I just had somebody pull up some statistics on mental health for me, because it is Mental Health Awareness Month. So anytime you're practicing mindfulness, you are doing something for your mental health. But look around the platform if you can, or look around your office and count to 10. 1 in 10 people are affected by some type of mental illness. 1 in 10 people have depression, major depression. And anytime people are experiencing chronic stress, that is a precursor to mental illnesses like depression. So if it's not you, it's somebody perhaps in the room, okay? And if it's not you, or you're somebody in the room, it's probably somebody in somebody's family at their house that they're dealing with, that is struggling or challenged with mental illness, okay, or lack of mental wellness. So it can benefit you at your job, it can benefit you at home. Some things you could do to incorporate mindfulness. My Stress Tools. This is a product that we offer, MESSA, our members. You can find it in my MESSA platform on our website. You log in, again, use your credentials. It's on the left side, a gold strip. You'll see under Health Wellness Resources, you'll see My Stress Tools. Click on it, a box will come up. It'll take you to another website, the My Stress Tools website. Now, if you try to get to My Stress Tools from the internet, you won't be able to log in. Because you're a MESSA member, you'll get in through My MESSA automatically. It'll say, hello, Ray Ann, hello, Rhonda. It knows you. First thing you want to do is take the stress profiler. It's a questionnaire, and it'll rate your stress. It'll give you a number. So you'll have a baseline. It is a suite of activities that helps us understand the neuroscience behind stress. So there's activities you can learn to help you lower stress, information you can share with your classroom. If you are a group leader, it's information you can share with your group. Topics like emotional intelligence, cognitive restructuring. If you want to have a coach walk you through some mindfulness, there are mindfulness recordings. The resilience challenge Our resilience coaches in there. If you like webinars, there's videos, there's podcasts. It's a plethora of things you can do in there. Check it out for me. And actually, later on today, I'll have Jim here, Jim Porter. He is the creator and founder of My Stress Tools, and he's going to tell us about some of the new activities on there. I noticed the other day, it is an activity called Diet Coach, and it's an activity called Behavior Coach. So he's going to come on and tell us a little bit more about the new offerings. But My Stress Tools can help you personally, and it can help you identify different activities you can do with your groups or with your department, with your work culture. Mindful Monday, that might be sending out a message that you get in My Stress Tools, sending it out to your group, talking about the science of stress management, or a mindfulness video, a 2-minute video showing people how to practice mindfulness. Gratitude is a mindfulness practice. Even though oftentimes with gratitude, you're thinking of something in the past, mindfulness is talking about focusing on the present. Often with gratitude, you might have to grab something from the past. However, what happens is that you think about something that happened and it changes how you're thinking or feeling in the moment. You practice appreciation, lots of research on it. It changes the neurochemistry in your brain. So you can potentially lower your stress hormone, cortisol, and heighten perhaps your dopamine or your serotonin by practicing appreciation or gratitude, right? I like to practice it by just waking up in the morning and thinking of things I'm thankful for. Incorporating it in your work site, you can have an appreciation moment right before a meeting or during a meeting or after a meeting. You could have an appreciation board. I know there's school districts doing that in the break room where colleagues are just leaving notes about other colleagues and what they appreciate about them. Now, this not only benefits the receiver, right? Anytime you tell somebody you're thankful for what they do, you make them smile, right? But it benefits you for sending it out. It makes you feel good, increases your sense of well-being. So you're manipulating your neurochemistry milieu. You're changing how all your chemistry in your brain is being released. You're making yourself feel better. And there's research that supports that the better you feel, it's better for your immune system. I hear people talking about their immune system all the time. Well, we know stress can depress your immune system, compromise it, right? So potentially, let's say you incorporate a gratitude practice at your work site. When you walk in the door, you got to say something you're thankful for. You got to acknowledge somebody. You're potentially helping people avoid a cold, right? You're increasing their immune system. You're boosting their T cells and their white blood count. So you're helping your colleagues. You're changing the culture of your workday. Perhaps somebody's having a bad day. Remember that 1 in 10? So somebody might have walked in the room. They might not have a mental illness, but they might be dealing with somebody at home that is challenged with a mental illness. So you can brighten up your workspace. Virtual mindfulness meditation sessions. And most self-care activities are somewhat of a mindfulness practice because it's taking you out of those places that are making you feel anxious or shame or regretful or remorseful. Anytime you're thinking or you're focused on the past, it's usually with a regret, right? Remorse. Oh, I shouldn't have did that. You're ruminating on something that happened in the meeting, something somebody did for you. That heightens your stress hormone, which can lead to depression, right? Or you're thinking in the future, you're worried about the meeting. You're worried about, I might say it wrong. You're worried about what might happen, right? Again, that initiates the stress response. So that leads to anxiety. So even self-care activities can take you out of those places and you focus on the pleasure in the moment, the massage or the facial or whatever type of self-care activity, the mindful walk that Kara mentioned. Right?
Rhonda, we've got a couple questions.
Yes.
Will the Wellness Pro Wednesday be open to everyone, and are the Wednesday meetings recorded?
Wellness Pro Wednesday is open to everyone. Please come. The last one for this school year is next week, Wednesday. You can register at MESSA.org And if you go under the health resources category, I think it'll come up Wellness Wednesday. You go there and register. And what was the second question? Will it be recorded?
Yeah.
I haven't recorded it. My plan is next year to start recording them. Is that it?
Yeah, I think, yeah, we're all caught up on the questions.
Thank you, sir.
Thanks.
Andrew, one of our Eastern field reps. So movement. Kara gave us a lot of information. I think she dropped the mic on movement. The benefits of movement improves your mood. We're talking about mental health awareness. Mood is very much your mental wellness state, right? So we know there's research that supports movement, reduces feelings of depression and anxiety. And there's even recent studies that exercise is competing with medication and maybe winning, okay? We don't encourage people to stop taking their medication. Definitely do what your healthcare provider is guiding you to do, but you may consider including more movement to supplement what you're already doing, your physician's plan. Move more, or perhaps before you even consider the medication, talk with your doctor about a movement plan. Maybe consider I should just move more. I have a sedentary job. Maybe my my feelings of low motivation may be related to lack of movement. And to help you identify this or become more aware of it, the health risk assessment can help you by answering questions and helping you be more aware of what you're really doing. It builds resilience to help you cope with stress, especially intense types of movement, like high intensity interval training or high intensity strength training. It builds resilience because those type of exercises actually are stressing your body out. They put your body under a lot of stress and your body learns to recover quickly. So when it's almost like, what's the word I want to use? Not visualization. What is the word for when you are simulating stress? Your body simulates stress when you exercise, and it teaches it to recover quickly. So when you experience stress in real life, your body knows how to recover quickly. So doing group or community activities, it provides social support. So when you create health-themed activities, I mentioned walking challenges earlier, you're giving people an opportunity to be engaged in a movement challenge, and you're modeling the behavior. And oftentimes, work time is the only time people are exposed to this type of behavior. So it's great to put it during the job, but it extends to the household and then perhaps to the community. Do a walking challenge or have an exercise or a yoga class. And just like Carolyn said, it doesn't have to be a marathon. You don't have to do a bodybuilding contest. It's just getting up perhaps every hour, every 90 minutes and wiggle your hips or reach your arms up because you're increasing circulation. We got to get that oxygen to our brain. And for a work site, we want everyone to be able to produce. We want everyone to feel good and be the best they can be. So incorporating that during the job, more oxygen to the brain, more circulation to the limbs by increasing movement. So again, a walk or step challenge. You can create a challenge. There's lots of virtual or online platforms out there, and there's some free ones actually. If you look, you can download apps or even get on the internet, Google free walking platform, and you'll see the different platforms out there that are similar to Fitbit, right? Or I've had school districts create their own by using Google Docs, just a way to track the steps and have people enter the information in Google Docs. And it doesn't always have to be a challenge or a competition. It can just be a walk. It can be walk it Wednesday or move it Monday, just putting that on the calendar, right? Every Monday, you guys were moving. Every Wednesday, let's get out and walk. If it's a snowstorm, we're gonna walk inside. We can walk in place. So now we know we can walk in place. We've done plank challenges. We incorporated a plank challenge when we were social distancing. We did it virtually, and it was really fun. And it's just about movement. Group exercise classes during lunch. You may have people in your community that want an opportunity or they want to be more exposed to the public. They need an opportunity to do a group exercise class. You may have a personal trainer, a yoga instructor that wants to come in your school, right? Or when you do your health interest survey and you already know you want to do a yoga class, put on the health interest survey, do you have exercise skills that you want to contribute to this initiative? And then you might have that yoga instructor, a Zumba instructor, or a group exercise instructor right there in your school worksite community. I used to do Zumba classes here at our worksite wellness program. So there's somebody out there, I'm sure, that could do that for you. Create a fitness directory. We did that with our worksite wellness as well. We ask all our colleagues, our coworkers, what is your favorite fitness place or your favorite fitness person? We put it all in a directory and we filed it where everyone has access to it. And just to encourage people, it might not always start at moving, it might just start at providing information, disseminating information. That might look like putting free posters up in the school. People might not be in that ready stage, you know, and what is that theory? Stages of change. People might not be ready for action. They just might be in contemplation, and you just need to change the environment to send messaging, to give them verbal, visual cues, right? So we have free posters available. Some posters talk about walking. They have beautiful images. So every time you walk by it in the office, you see somebody jogging or you see them with their walking shoes on, and it triggers something in your brain. You're like, okay, I have to do it. I need to do something. So you put them in key places. You can put them in the break room. You can put them in the bathroom. You go to MESSA.org, okay? And again, under health resources, you'll see free posters. There's posters for walking. There's posters for medical exams. So you're just basically creating an infrastructure that motivates people visually and through messaging, because they're not ready to do it yet. You can't make people do things they're not ready. So you're changing the environment, you're having them do a health risk assessment, because now they know it's me, I need to do it. And eventually, perhaps the next school year or later on down the year, you'll see them bringing their gym shoes to work and they're ready. Never get discouraged. Nutrition, mindfulness, movement, nutrition. Nutrition is very important when it comes to mental health. You know, and I love fitness. I love exercise. I've always used exercise to boost my mood. But I've learned so much over the years about how the connection between nutrition and our mood, our mindset, our mental health, and it's the gut-brain connection. So if we're eating more processed foods, we're not getting the nutrition we need that creates the neurotransmitters. We've been throwing that word around, neurotransmitters, dopamine, serotonin. Well, they take ingredients to create, right? Our body uses the minerals and the vitamins from food to create serotonin, to create dopamine, to create all these chemicals that help us feel a certain way. Well, when we're not eating that food, our body is not able to create the serotonin. So the first thing we feel is a low mood, or we feel depressed. Now, how many people eat cucumbers when you feel depressed, right? No, I doubt it. If you do, you're good. But most of us, we want potato chips. I want ice cream and potato chips. I want the sweet and the salt. So how many nutrients are available in ice cream and in potato chips? Very little. Now, I'm not suggesting you stop bringing potato chips and ice cream to the worksite. No, I'm suggesting perhaps including some activities in your worksite wellness program that raise awareness about the importance of nutrition, okay? Maybe a healthy recipe challenge, or lunch on a Friday, everybody brings a different kind of salad. So you're getting some fresh vegetables. Because remember, a healthy diet reduces your risk of depression. That may be all you need to do is improve your diet. It can help you focus. You might be missing things because of lack of nutrition. You know, first thing we want to go to is, I'm forgetting things. Do I have Alzheimer's? No, you might just need some B vitamins or some vitamin C. You need to just eat better, perhaps less sodium, less sugar, and less salt. So helping your colleagues out, because we're all under stress. Everybody's under stress. And it's hard to check off all the boxes when we're under so much pressure. So Worksite Wellness Initiatives is about helping our colleagues. And when we help our colleagues, it helps us. So some things we can do. A mindful eating challenge. And again, mindfulness is about being in the present. So a challenge is kind of a hard word to put that. What do they call it? An oxymoron. But it is, we're just getting people together to do it as a group. But it's about eating in a more relaxed state, enjoying the present, enjoying the food, noticing the food. How often are we rushed through our meals that an hour later, 2 hours later, we're hungry now? Right? We want to slow down and enjoy the food. It's a lot of experts connecting our rush lifestyles and those type of eating behaviors to digestive issues like irritable bowel syndrome and a lot of the gut issues that people may be experiencing. Salad jar lunches, everybody bringing in something different for a Friday in the jar, make it very easy. Or perhaps a newsletter with healthy recipes. What we did here about a year ago, 2 years ago, is we did a couple of healthy recipe contests. And we had people send in recipes and we put it in categories. So it was healthy desserts, healthy dinners, healthy appetizers. We collected that information. We judged and we gave out prizes. However, we collected this information and made a recipe book. It was a great project. I never expected it to turn out like that, but it's a great project and we share it to this day. It's on file. So if people want some ideas on cooking healthy meals, we have our own recipe book. We'll put it in a time capsule and they'll pull it up in 1,000 years, perhaps. May is Mental Health Awareness Month. Now, and be mindful that every month has a health theme. You could go to National Institutes of Health or the CDC.gov, and you can find out what every health theme is for every month. This can help you as a wellness team. So next May, you might want to do something for mental health awareness. It's also Women's Month. It's also Meditation Month, right? We know, I think November is diabetes awareness. So diabetes, the month of diabetes, you and your wellness team might decide to do something to raise awareness of the risk of diabetes because you know of coworkers that have been struggling with it perhaps. So it is something you want to bring awareness to. Or perhaps you have coworkers that are struggling with heart disease. So February is Heart Month. So you might decide, okay, let's put this on the calendar for the month of February. We're going to do things to increase awareness about heart disease. We're going to disseminate information. We're going to put things in the newsletter. We're going to have a blood pressure clinic, different ideas you can do to help increase the knowledge. It's about empowering each one of us, empowering us with information so we can take charge of our health and our mental health. There we are with My Stress Tools. I mentioned that earlier. Great information in My Stress Tools. And also, Andrew, are you available?
Yeah, I am. Yeah, so I'll talk briefly about Blue Cross online visits, and I'm always glad that Rhonda includes information on this program as a part of wellness, because how can we really focus on wellness if we're not taking care, if our bodies aren't in good shape? And so one of the things that we always like to promote is the Blue Cross online visits that are available to every member who has a MESSA medical plan. You have access to an online provider. Now, a lot of times we work with our providers at like our local clinics. So you might have a primary care physician that you work with through Beaumont or through Henry Ford or through Spectrum Health. Blue Cross online visits, whether you have an affiliation with a particular clinic or not, will give you access to speak with a medical doctor. So you don't have to have that relationship, again, through a local clinic. You can access any one of a number of doctors that are always going to be available through the Blue Cross online visit app. And it is an app that you can download either on your iPhone or your Android device or even your computer. And you can speak with a medical doctor for acute sort of conditions. So things like respiratory illnesses, colds, If you have young children in the household, and you just like an opinion on an acute condition, again, if it's an emergency, go to the emergency room. But any acute conditions are things that doctors through the Blue Cross Online Visit app can help with. If you need a prescription, if you have a sinus infection, and the doctor prescribes an antibiotic, or if you have a child that has, let's say, pink eye, there's an antibiotic eye drop they can prescribe. The nice thing about this feature is that the doctor can actually send the prescription to the pharmacy of your choice. So you can go pick that up. You don't really need to leave the comfort of your home, except to go pick up that prescription. Blue Cross Online Visits can also provide you with a doctor's note. So if you're out and again, if you have an acute condition and you need a doctor's note either for your child or for yourself, they can provide that to you, email that to you. And it's something that you have access to. It's not it's not available to you for free. It is subject to your deductible, but it would be free once your deductible has been met, either with a copay if you have one of our Choices health plans, or no copay at all if you have our ABC health plan.
Thank you, Andrew. Thank you. So your Blue Cross Online Visits, they can download the app, and you can get mental health visits and counseling with this service. So say, for instance, you're at work, you don't want to go to a doctor's office, you can identify a physician and do a visit from work, from your car, from a class you're in. So it's very convenient. We brought the Jetsons to the MESSA benefit.
Yeah, thanks for mentioning that too. Yeah, I forgot to say that mental health visits, you may have to schedule an appointment for those, as opposed to just picking from an available doctor for any other condition. But that is something that's an option to you as well. There's two sections, medical, and then there's a behavioral or mental health section component. And you just click on that and schedule an appointment with a mental health provider. And that is always available to you as well.
Excellent. Thank you. Thank you, Andrew. Let's see. Also, we've just recently brought this to MESSA, another resource for your mental health. And I always say, MESSA, we are very compassionate about our members' health. We want to help our members prevent chronic health conditions, and we want to help our members. We want to support them if they have a mental illness, and we try to bring as many products and benefits as we can that can be there for them. This is a new resource that we brought on this year. It's called Able To. This is a unique program. It's different from our mental health visits. With this program, once you are registered with it, they assign you a licensed therapist that guides you through a 8-week personalized program. Okay, you provide them your medical, just like you would do with any counseling or therapist visit. But in addition to that, your goals, some of the things you want to see happen in your life that have been perhaps held back by your mental condition or feeling depressed or anxious. This licensed therapist provides you a customized plan to help lead you to achieving those goals. And it's done to make sure that it is beneficial to you and it is helping you. And again, we are compassionate about helping you. And we know mental wellness is very important right now. A lot of people are going through different things. And if you are considering doing a campaign, you just want more information. It doesn't have to be a formal campaign. You just might want to start disseminating information to your colleagues, to your population. Some great resources are the National Alliance of Mental Illness, and these are nonpartisan, nonprofit organizations that are dedicated to the research, awareness, and supporting people who are either a relative of somebody suffering or challenged with a mental illness, or they have it themselves. Mental Health America, they also provide campaigns, flyers, resources like that to give out, and Anxiety and Depression Association of America. And like I said, the percentage of a U.S. population, adults has risen in the last couple of years for anxiety and depression and children, okay? And we know that chronic stress is a precursor to anxiety and depression. And we have to get more comfortable just talking about those things. We're fine talking about fitness and nutrition. We need to talk about mental wellness. Thank you for that. And making sure we are supporting everybody. And you know, oftentimes mental illness can manifest in chronic health conditions like diabetes. It can show up as blood sugar issues, or it can be a precursor, or it can be a part of diabetes or heart disease or blood pressure issues. So we definitely have to shine the light on them and make sure we're getting people the help they need. MESSA resources. I can help you. If you want to get a Worksite wellness program, we can talk virtually, or I can come to your Worksite. I can talk to you personally or your team. We can set up a time and we can talk about what you want to do for your space, what makes sense. You can reach me at healthy@mesa.org. I provide lunch and learns with health topics, stress management. Sleep is very important. We didn't mention sleep, but sleep is very important and it's linked to depression and anxiety as well. You could be suffering anxiety and depression and not sleeping, or if you're not sleeping, eventually you're going to suffer from anxiety and depression, okay? So I do sleep, nutrition, fitness in the workplace. We can do them lunch and learns, association meetings, staff meetings. I can customize them to your need. Our field representatives, we love our MESSA field reps. They're the people you call if you have some claims, questions. They're right in your area. They're probably at an office in your area. They attend association meetings. They can help explain the plan, and they can personalize it for you because they're in your area, and they're there to create an alliance with you, create a relationship with you, and be your go-to. So definitely our field reps, and you can go to our website. If you're wondering what MESSA field rep is in your area, you can go to our website and their pictures are right there, and you have a little map of Michigan. Somebody will probably put that in the chat for you. We have an award-winning member service center. Okay, you can reach them via chat from our website, or you can call our 800 number. Most people are using chats nowadays. They answer and you talk to a real person. Okay, if you call, you're not going to talk to artificial intelligence. You're going to talk to a MESSA employee, and they're going to answer your questions. Okay. Our medical case management, that's where I started with MESSA as a medical case management nurse. Unique program, not a lot of places do it like MESSA. We help our members that are suffering from catastrophic illnesses. What is catastrophic, Rhonda? Economic consequences, financially burdensome, emotionally burdensome. It's challenging for you as the caregiver. You have multiple providers. You might have several different doctors and specialists. You might need specialty equipment. You might need specialty pharmaceuticals. We provide a case manager in your area. So our case manager at headquarters manages the case. They assign a case manager, a registered nurse that is certified in case management in your area to you. They meet with you or your loved one. They can attend appointments, and they are your in-between person. They fill the gap for you. So they understand the medical terminology. They know who the best providers are in your area, and they can help arrange and coordinate the medical case for you or your family member. That is a benefit on your medical, on your MESSA plan. Put in the chat if you already knew this. Did you know we had a medical case management program? If so, put yes in the chat. If not, put no. I just need to know. And also, Omada and Livongo, both of these address diabetes. Omada is for pre-diabetes. If your doctor has said you have metabolic syndrome or you're insulin resistant, Omada can help you, okay? You take the questionnaire, you find out if you are at risk. It's a free benefit, it's digital, and basically you're assigned a coach. The coach helps you navigate your health by helping you understand stress management, nutrition, and the importance of movement. The goal is weight loss, 10% of your weight loss. Once you reduce your weight, your A1C is your average blood sugar. Your blood sugar comes down and your risk for diabetes decreases. I think since we brought this on, and it's probably more now, we have a total of 20,000 pounds lost aggregate people on this program. If you're familiar with Noom, it's same framework as Noom, except this is a part of your benefit and it's free. So I don't know what they're paying for Noom. I don't know what they're paying for Weight Watchers nowadays, but this is free if you qualify. Livongo is for our members that have already been diagnosed with diabetes, and it's a great way to get your supplies. Also, if you are having issues managing your blood sugar, there are coaches available. Also a part of our wellness offerings. Wellness is across the whole healthcare spectrum. For our those of you that are planning or need help with your reproductive health, parenting issues, Ovia can help. Again, that's an app. 3 different subject matter though. So if you are trying to get pregnant and perhaps you're having issues or struggles, if you're already pregnant, there's education and information for that. And for the early parenting stages, there's information for that. Remember, we're online. Go like us on Facebook so you can keep up with our conferences and whatever we're doing and our health tips, our nutrition tips. We're also on Instagram, and this recording will be on YouTube, okay? You'll get it probably no less than 2 weeks. We edit it, we clean it up a little bit, but we'll send it right to your email. Now put this on your calendar. Join MESSA Wellness Pros, register, okay? My last one for the school year is next Wednesday, 7 a.m. or 4 p.m., okay? I would register anyway because when I send out the notification for next school year, you'll be on the mailing list. And we talk about everything. I don't lock it into what I've scheduled. Whatever the topic at hand, whatever the hot topic is in wellness, we talk about it. We benefit for our personal wellness as well as for our worksite wellness opportunities.